David Edgell. I'm the project lead for Delaware Plan4Health, and this is our mini webinar in December 2016. Delaware Plan4Health, our goal is to make Kent County the healthiest county in Delaware. We chose Kent County because the health data indicates that Kent County has some health challenges similar to those impacting the state and the nation, and we wanted to know how can the maps. We created 5 different maps with health data in the county, and these maps were based on our grants goals of access to healthy foods and active living. The first map was an equity composite map, which talks about the social determinants of health, and we're going to go into that in all these maps in a moment. The second map was parks and open space density, identifying where there was potential for more parks. We had a sidewalk density map where there was potential for more connectivity. Bikeable density identified areas where we can improve bicycle access and transportation. And then finally, a retail food environment map which showed how the access to healthy food was distributed across the county. Our first map was the equity composite map. This map looked at census data and part of the calculation included the percentage of a variety of indicators that were indicators for the health equity. These include percentage of seniors, children, household incomes with less than 200% of the area median income, non-white populations, households on SNAP, which is the former food stamp program, households with no vehicle access, and those with limited English proficiency. One thing you'll notice from the maps is that we focused on zip code boundaries. From a planning perspective, these geographic areas are not ideal, but they were the areas that we could have all of the data available in one format. It would also tied to our eventual random sample survey on the telephone, which we used. So in this map and in all the maps, the data were organized by tier, with the top tier, number 4, being the area of highest need, meaning the most health concerns. And the thing you'll notice about Kent County is that the city of Dover is a small city of about 36,000 located in the middle of the county, and most of the county is a fairly suburban and rural area. So we see the most social determinants of health indicators located in and around the Dover areas, zip codes 19901 and 19904, with some in south of Dover and a growth area for Kent County. The next map is the parks and open space density map, and this is simply the acres of open space and parks divided by the total population, and again organized by the zip code level. And you'll see that some of our areas in Dover and around Dover have the highest tier, but the darkest color are the more rural or undeveloped areas that don't have a lot of access to parks or preserved open spaces. The third map is the sidewalk density map, and that's the areas, the miles of sidewalk divided by the population in the zip code. And as expected, the built-up area in Dover certainly has the most access to sidewalks, and some of our rural areas and small towns have less of those areas. And this is our next map, the bikeable density map, and the state of Delaware Department of Transportation, we call DelDOT, they are moving away from simply calculating bike lanes, and they're looking at a new measure called the low stress bicycle network. And generally, that comprises of mapping road segments and trails that have a low traffic stress and allow the bicycle rider to feel comfortable riding their bicycles. And these may be off-road pathways, wide bike lanes, or even low traffic residential streets and subdivisions and neighborhoods. So they're just starting to work on that information, and we were able to get an early version of their data and calculate the miles of low stress bike network by the population in each of these zip codes. And then our final map is a map showing the retail food environment, which is the unhealthy food access areas, your fast foods and convenience stores, divided by the healthy food access, healthy food retail environments, supermarkets, produce stores, and farmers markets. And what you'll see here and what we noticed is, the more rural areas, the darkest color, that don't have very many grocery stores, they certainly had the highest need for healthy food access. And if you can squint, you'll see on the map there's little circles with shopping carts in them. Those are our supermarkets and our healthy food stores and farmers markets in Kent County. And the circle around it represents a walkable quarter-mile radius, so we can see those on the map. And then finally, we used all this information to identify two areas in the county to hold our planning charrettes. One interesting thing we found from the maps is that not one zip code stood out in all the different measures that we used, but in Dover, as the largest city and the most urbanized area, especially with the social determinants of health factors, we found that the downtown area was an area that we wanted to focus on, and we held our charrettes in on the left here. It's an area that they're already doing a planning study on called Restoring Central Dover, and so we held our planning charrette in that area. And on the right in Kent County, we selected an area that's in the zip codes comprised of Magnolia and Woodside. These are areas that are sort of in the Kent County growth zone, which means it's where the county's encouraging suburban residential development, but it's also interspersed with agricultural areas, some small towns, and some traffic corridors. So we used the information from the mapping exercise in conjunction with our survey to select these two areas and conduct the two planning charrettes. So if you have any questions about the maps or the process that we used, there's my contact information. Again, I'm David Edgell. I'm the project lead. You can also contact Tim Gibbs with the Delaware Academy of Medicine and Michelle Eichinger, our primary consultant, and she's with Designing for Health. Thank you for joining me this afternoon, and I'll turn it back to you, Elizabeth.